The third thing which is often comes to us as shoulder pain is pain at the back of the shoulder there. And there will be areas along the shoulder blade which will be extremely tender and will be triggering on deep pressure. These come from an entity known as scapular dyskinesia, which means that the shoulder blade, which is the bone behind the shoulder, is not placed properly against the rib cage. So this usually is corrected through a system of exercises, but we must understand that pain at the top of the shoulder blade, which can mimic shoulder dyskinesia, can also come from a pinched fifth or sixth nerve in the neck. So a clinician will be a little more attentive looking at these factors also. The third thing about shoulders which is troublesome these days is that of instability. We are all using the gyms, and in the gyms we have a tendency of actually doing bench presses and flies where the shoulder is going way behind us. So every time there is a stretch on load, the front of the shoulder starts opening out more and more and gives rise to a loosening and a progressive instability. And you can always say, I didn't have a fall, मेरे को तो चोटी कोई नहीं लगी, मेरा कंधा क्यों अनस्टेबल है, या मुझे इस प्रकार की पोस्टीरियर इम्पिंजमेंट क्यों हो रही है, यहाँ पीछे की तरफ दर्द क्यों हो रही है, जिसमें इम्पिंजमेंट का पेन पीछे क्यों है मुझे. These happen from a wrong exercise technique. I think you should speak to your gym instructors and to your doctors to find out what is the right technique and what is specific to you as an individual that you should do specifically for avoiding these injuries. Falls often lead to shoulder dislocations, and the sad part is that in the young people, shoulder dislocations are invariably recurrent events. So much so that there is now a large move amongst shoulder surgeons to primarily, which means at the time of the first dislocation, do a surgical stabilization of the shoulder to prevent a very high incidence of recurrence, which can go as high as 95 to 98%. Right? As we get older, and senior citizens who have shoulder dislocations have a lesser chance of recurrence because they get more stiffness. The third thing which comes to us as shoulder pain very frequently is labeled as a frozen shoulder. A frozen shoulder is a non-clinical term. It basically means a shoulder which is not functioning properly. It doesn't have a full global range of motion. See, the shoulder has huge movement because nature has made it so we can reach every part of our body. It is a prehensile joint. Once you get a frozen shoulder, we need to understand why is it there. Is it related to certain diseases, certain habits, certain injuries? And the treatment obviously is to correct those. And then lastly, intensive physiotherapy, which involves a lot of manual release and manual therapy. If you are rigid on your exercises, if you're rigid on your physiotherapy, most frozen shoulders will open up. We can inject frozen shoulders to relieve pain and sometimes to facilitate the physiotherapist. But those frozen shoulders, especially those in diabetics, where movements, especially rotational movements, are very limited, or they are present in those people who have had an injury, or are present in ladies who are very osteoporotic, where manipulations have a risk of fractures. In those people, we like to do a controlled surgical release, for which we use an endoscope, and it's called a controlled or endoscopic shoulder release surgery. I think by and large, this is how most shoulders will present to us. There are rarer instances. There's arthritis of the shoulder is not very commonly seen, whereas arthritis of the joint on top of the shoulder, called the acromioclavicular joint, where the shoulder blade meets the collarbone, is very common. And this is more commonly seen in overhead lifters. People who have overhead lifting as one of their exercises or one of the way that they play sport. So there is a different way of treatment. Once again, conservative therapy, glides, injections, and then rarely surgeries. So I think in a nutshell, the shoulder is not one joint, it is multiple joints put together, and there are various reasons why a shoulder will hurt. It pays for you to be patient, it pays for the doctor to be systematic and stepladder in trying to come to a conclusion, and usually outcomes of these treatments are brilliant. Thank you.